Hello, this video is on gum surgery or periodontal crown lengthening in conjunction with veneers. This young woman had what's called delayed passive eruption. Now, she'd been to the dentist all of her life, and for some reason the dentist didn't know what this was. It's when the teeth are this short. Delayed passive eruption means the crown of the tooth is under the gum. It just is still covered by the gum. You can see how short those teeth were. So you take a periapical radiograph and you can see the clinical crown of the tooth is right here under the gum. It just has to be uncovered. So her teeth were only 6 millimeters. You'll remember the average central incisor is 11 millimeters. So there was 4 or 5 millimeters of clinical crown of the tooth, not the root, but the clinical crown under the gum. Those are both 6 millimeters. So I raised the gum, did what's called a periodontal crown lengthening, and then veneered the teeth. You can see how much better that looked. She was about 33 and she said, "I've waited my whole life for this." People just didn't know what that was, or I don't know what the reasons were, but anyway, you can see how much better that looks. Interestingly enough, she got married 6 months after we did this, so I'd like to take all the credit, but I don't think I really can. You can see the difference. So these are 10 or 11 millimeters long right now, and to do the periodontal crown lengthening surgery, you've got to actually remove some bone around the tooth and some gingival tissue. It's not a painful thing, but remember the alveolar crest, or the height of bone, must be 3 millimeters from the gingival line. So you can't just remove the gum tissue. You can't just do a gingivectomy. You've also got to do an ostectomy. Dr. Pat Allen, a fabulous cosmetic periodontal surgeon in Dallas, taught me how to do this. So you want the bone level to be 3 millimeters from the gum line. So you have to create a new alveolar crest line in addition to a gingivectomy. This woman had had veneers placed on the lateral incisors, but she just hated her smile. She said, see, the veneers were dark, but also the gingival line hadn't been corrected. You can see how these teeth are short. So you must do a periodontal crown lengthening. You want the gingival line, the incisal plane, and the lower lip and the pupillary line to be approximately parallel. So you want the gingival line to be parallel with the incisal plane. So in this case, I replaced the veneers on the lateral incisors, which were too dark, and then raised the gum, did a periodontal crown lengthening on the lateral incisors. So you want the gingival line of the lateral incisors to be a little bit incisal, a little bit this way to the cuspid and the central incisor. So this is after I've done the crown lengthening on this tooth, and this is before and after I've replaced the veneer, and this is before and after I've done the crown lengthening. This is before the crown lengthening, after the crown lengthening, and the new veneer. So this is her before and after with new veneers on the lateral incisors and a crown lengthening on this tooth. You can see it's a subtle difference, but significant to her. So this is after we finished. You can see the gingival line is symmetrical now. Here she is before and after. So see, the gingival line is the same as the incisal plane. This young man had had a veneer or crown placed on that right central incisor, and you can see the gingival line had not been corrected. So his mother and father were patients of mine, and she brought him in and said, her words were, he looks like a goober with that little short tooth in the front. So they'd put a crown on that tooth, but the gingival line had not been corrected. So I want symmetry. The gingival line and the incisal plane should be approximately parallel, and the incisal plane of the central incisors should be parallel to the pupillary line. So this is where I want to take the gingival line. See, now I've done a crown lengthening on these teeth. This right after the surgery. This after a week of healing. You can see the gingival line is up to here, and I also did an ostectomy on those teeth. So this is before and after I did the crown lengthening surgery and then placed veneers on these 4 teeth. See how the gingival line is symmetrical now, before and after. See the difference. This woman is such an interesting case. She was going to have the 2 central incisor crowns replaced, and she was from out of town again, about 3 hours from here, and I'd restored her sister, and so they were going to replace just the 2 central incisor crowns, and her sister said, I think you may need more than that, and she recommended she come see me for a evaluation. So what you'll see here is the incisal plane and the gingival line slants this direction. It's not parallel to the lips and the pupillary line. The pupillary line, a line between the pupils, represents the horizon, the tabletop, and the floor. So you want the incisal plane and the gingival line to be parallel to the floor, which is also parallel to the lower lip. So see how everything slants like this. So I said, no, you don't want to do that. Plus these teeth were very unaesthetic. See how they're splotched and discolored? I said, if you just want to have those 2 crowns replaced, you should go back to your previous dentist. But if you want to fix this in the front, we should correct the gingival line and veneer the teeth back to the bicuspid teeth. You can get away with just veneering or restoring maxillary anterior teeth, and I don't worry about the shade of the lower anterior teeth. Ideally you do them both, but you can see when you smile you really don't see the lower teeth that much. So we started with just the maxillary anterior teeth back to the bicuspids. You can see she had those 2 old crowns on the central incisors. So the first thing I did was create an incisal edge that I wanted to be the go-to of the incisal plane. I wanted everything else to meld with the incisal edge of that tooth. So this is where I wanted to raise the gum. And remember, you also need to do an ostectomy. The alveolar crest, or the bone level, should be 3 millimeters from the new incisal gingival line. So the gingival line should be 3 millimeters from the bone line. It's not a painful surgery, but it just has to be done. If you only remove the gum tissue, i.e. a gingivectomy, that gum will grow back and you'll have inflamed, red, irritated, bleeding gums. So this is going to be the new gingival line. And remember, the bone line, or the alveolar crest, should be 3 millimeters from the new gingival line. So this is after I've done the gingivectomy and the ostectomy. So this is the new gingival line, and the bone line, or the alveolar crest, is 3 millimeters from that. We internally bleached the central incisors because they were so dark. This is after the surgery. This is after a week of healing. You can see how fast the soft tissue heals. This is the new gum line. There's very little pain with this. Often don't even prescribe pain medication. So I want the incisal plane of the centrals to be parallel with the pupillary line. And then I want the incisal plane and the gingival line to be parallel to the lower lip. So we bleached this tooth internally. It was a dead tooth, and these are veneers on her maxillary anterior teeth back to the bicuspids following healing of the crown lengthening. This is her after. See how the incisal plane now is evened up. It's parallel to the lower lip and the pupillary line, and the gingival line is parallel to the incisal plane. You can see what a difference it makes veneering back to here, because the shade of these teeth is not good, and you can't square these up without squaring up the gingival line in the adjacent teeth. So we didn't restore the lower anterior teeth in this juncture. We did it later on. This is before and after. So we've gone back to the bicuspids, the teeth that show when she smiles, because we're lightening the shade. So these teeth had crowns, so you replace them with crowns, and then we veneered the adjacent teeth back to the bicuspid. So you can see she still has some gingival display. Well, why didn't I get rid of all the gingival display? You don't want an incisor tooth to be more than 12 millimeters max. You don't want it to look like a horse tooth. So if you raised the gum all the way up to here, number one, you'd be on the root of the tooth. And number two, the teeth would look like horse teeth. Studies have shown that gingival display alone is not considered anesthetic. It can actually be considered very cosmetic. You just don't want little bitty baby teeth with a lot of gingival display. That makes the person look like they're about 12 years old. So you don't make the tooth, the central, longer than 12 millimeters max. If somebody wanted to remove more gum tissue, you would have to do orthognathic surgery and actually take some of the bone out of the upper jaw to impact the maxilla. So that's not necessary from a cosmetic standpoint. You know, just having symmetry and attractive anterior teeth is enough. You can't believe the things that happened to this woman when we finished this case. She'd been working at a kind of a mediocre job for about 10 years. Once we did this, she became head of that division over everybody in the United States that did what she did. So is it the way she felt about herself or the way people looked at her? I contend that if you look at this situation, you're just not as impressed as you are with this one. All right, this is another case, had some dark teeth here and gingival display, and the teeth were short. So we do, in this case, we've raised the gums and also the bone level, crown lengthening, and then veneered the 4 maxillary anterior teeth. Remember, the incisor teeth are normally, or the cuspid teeth are normally about a half shade darker than the incisor teeth. So you can make those teeth a little bit lighter than the cuspid and get away with not going all the way back to the bicuspids. Before and after, see the gingival tissue and raised, and it's symmetrical to the incisal plane. This person had just had some bad habits, and his dentist had told him he was going to have to take all his teeth out and have a denture, and his mom just went crazy and said, he's only 25, we can't do that. And so the dentist had been to some seminars I'd given. He said, well, there's this guy in Texas, you might want to go see him and see if he can do something. So they flew to Waco, lots of decay, and I said, we can fix almost anything, but there's going to be a lot of it's considerable treatment involved. And so the mom said, you know, let's do it, whatever we have to do. So we were able to save all the teeth. But the first thing that I had to do, see, there was decay between all the back teeth. So the first thing I had to do was move the gums up and down to get above and below the decay. So this is really not a painful procedure, but remember this is after a week of healing. See how I'm below and above the decay. Remember, the alveolar crest, the bone level, is 3 millimeters from the new gingival line. You don't just remove the gum, you have to create a situation that the biologic width will be healthy and established. So you want the bone level to be 3 millimeters from the gingival line. This is after a week of healing. So then we restored the teeth. We were able to save all the teeth, had to do some endodontics. But these are veneers on his upper and lower anterior teeth, crowns on the posterior teeth. These are veneers, crowns back here. Pretty dramatic case. That's the dental minute. These techniques work, and they work every time.
Are you ready to take your dentistry practice to the highest level possible? Of course you are. Subscribe right now to dentistrymasterclasses.com, where you will get Dr. Cutbirth's greatest work and best cases. Here's what you're going to get when you subscribe to dentistrymasterclasses.com. Incredible comprehensive cases not seen in Dental Minute videos. You will get an organized library of all the Dental Minute videos and Dentistry Masterclasses, comprehensive cases for study and reference, before and after photos of Dr. Cutbirth's fantastic restored cases. And all of this, I repeat, all of this is just $40 a month. This is something you cannot pass up. Subscribe right now to dentistrymasterclasses.com.